enter the room.
Good afternoon. My name is Dr. Oluwakayode Komolafe. I'm one of the doctors in this gypsy surgery. Please tell me your full name and age.
Hello, doctor. I'm Unity Brown. I'm 54 years old.
Oh, thank you. How do you wish I address you for this consultation?
Unity is good.
Oh, thank you, Unity. Could you please tell me the exact reason why you want to see us this afternoon?
Oh, doctor, I've been having a lot of pain.
Oh, sorry about that. Where exactly are you having this pain, and when did it start?
It's in my toe, in my right foot. It's my big toe, and God, it's so bad right now, doctor.
Oh, sorry about that. Now, we are here to help you. This pain started gradually or suddenly?
It's gradually. I mean, it was okay. It was been there for like last 1 week. It was initially it was less, but it's just been getting worse, and now it's very severe.
Oh, sorry about that. So, do you think anything make it worse? Does anything make it better?
Yeah, when I walk, it just gets worse, and I don't know, nothing is actually helping.
Oh, sorry. On a scale of 1 to 10, can you please score the severity of this pain? 10 being maximum intense pain and 1 being least pain.
I mean, it started off being like maybe 6 or something, but now it's like at 8 or 9, doctor.
Oh, this must be quite distressing for you. Do you want me to
Yeah,
get you a painkiller at this point, or you are comfortable to continue this consultation?
I'm okay. I can talk.
Okay, thank you. Apart from this pain, do you have pain in the other toe or other joints?
No, it's just that one, my right big toe.
Okay, do you have any fever? Any
No,
trauma in that place?
no, not really.
Okay. Has this condition occurred to you before?
No, this is the first time.
Okay. Do you currently have any long-term conditions, chronic condition like maybe high blood pressure or diabetes or joint problems?
So I have high blood pressure, and yeah, and I have this allergy, hay fever. Yeah.
Okay. So you have a fever and allergy. When were you diagnosed with high blood pressure? What are you using to control it?
High blood pressure I've been having for a long time now, and yeah, I take benroflumethiazide. It's be taken daily.
Oh, I see. For how long have you been taking this drug?
It's almost like 20 years now, doctor.
Okay, I see. What do you do for a living? Do you think this condition is affecting your daily activities?
Yeah, now it's starting to, I'm actually a taxi driver, and yeah, I'm not even able to press the brake. It's very painful
Oh,
now.
this must be quite distressing for you. I understand the way you feel. Do you smoke? I need to ask you some life questions, please. Is it
Okay.
comfortable with you? Do you smoke?
Yeah.
Do you drink?
Yeah, I do.
Okay, what do you smoke?
Cigarettes, I smoke like 20 in a day.
Okay, I understand. Do you drink alcohol?
Yeah, I drink like 4 pints of beer, maybe like 4 times a week.
Okay, I see. What about your diet?
Diet, normal, regular diet only. There's nothing special.
Do you do any form of exercise?
No, who has the time, doctor?
Okay, I understand you. I'll quickly like to examine you, Unity. This examination will include general physical examination, like
Mm.
a full blood pressure, respiratory rate, oxygen saturation. I also like to examine your limb and look
Okay.
at your feet.
Okay.
Thank you, Unity. Based on this examination, I will need to carry out based on, I think you have a suspected case of gout. Do you know what this is?
No, not really.
Yes, it's a condition that affects the joint, and it's caused as a result of precipitation of, as a result of deposition of certain chemicals called uric acid around that joint. Do you understand? What is your
Kind of, yeah.
greatest, okay, what is your greatest worries concerning this condition?
I mean, pain, doctor. I just want to get rid of the pain.
Okay. And what do you think we might be able to achieve you with this consultation today?
Just some pain.
2 minutes remaining.
Okay, I understand you. Now, when we have a condition like this, we need to carry out certain blood tests that will help us in the management. We need to carry out blood that will show the level of uric acid, blood investigation that will tell us about the markers of inflammations. Then we need to carry out to show the level of, to measure the function of the liver and kidney. We are going to give you, medication to control this pain, because this pain is so serious. So we are going to give you a NSAID like diclofenac. Do you understand?
Okay.
Then we are going to send you for a review. We discuss with the unit consultant for a review of your medication, because most likely one of the medication you are taking is precipitating this problem. The medication called fluothiazide.
Okay.
Do you understand me? So we are going to discuss
with the blood pressure medication, right?
Yes, your medication. We are going to discuss with the consultant on how to review it, because it's affecting you. Then I'm going to give you a follow-up appointment in 2 weeks. We are going to, in fact, we refer you to rheumatologist, because this condition is serious. Do you understand me? They are experts in anything that has to do with joints, but we are going to give you temporary pain relief. Then we may give you another, they may give you medication like coquicine, which will help you, but it will take some time. They may also take part of the fluid.
Hi, doctor.
I didn't talk about, I didn't finish so many things about management.
You think you didn't say enough, is it?
I didn't say enough. I wanted to say. I didn't say
that's
about
the problem. You just have, you know this case very well, right? That is the problem.
I've attempted it before.
Yeah, so that is the problem. This so it's very typical, where you just want to continuously talk. Did you realize that you didn't even let me speak throughout the management section? Even when I try to say something, you're cutting me off and saying something else. I want you to go back and watch the recording of this case. We'll send you all the recordings, but pay more attention to this particular case, because you've done that a lot throughout this case. Even during the data gathering, you're just asking the next question before I even answer. You did that at least 3 times during data gathering. You had all the questions lined up, and you're just asking the next question before I even answered the current one. See, be very careful about that. That seems very scripted, because you've already done this case. You're doing that. That you have to be very careful when you do that. Always pause whenever you ask a question. They're going to take some time to answer. Don't worry about time. So when the consultation is going well, even if you don't not finish anything, even if you don't do everything, you'll still pass if you give them enough time to answer properly, and if you you know treat their actual concern. So my concern in this was pain. My main thing was pain. If you had just given me a painkiller, that would have been more than enough for the management. So even if you didn't have time to mention everything, if you just understood what the main concern is, and if you treated that main concern, you'll still pass. But you completely ignoring the fact that there is a conversation that's going on. So you're just trying to tell me everything that is there in your mind. To be very careful about that. That tends to happen, especially when you know the case really well. So be very careful, because the examiners don't like this at all. They'll know that you've done this case. They'll know that you've seen this case somewhere, and they'll definitely penalize you for that. They'll think that you're scripted. Just learned all the questions and coming and blurting it out. But yeah, this one particular case, I want you to watch the video at least twice. Okay, make sure you watch the video twice and just go see what mistakes you're doing, because it's very typical of scripted doctors. This is exactly what shouldn't be done in PLAB 2. But you did the case really well, but this is gonna hurt you so much. Even if you cover everything, this they will cut marks for this, because you're interrupting the patient. You're not letting the patient. You're asking the next question before the patient answers the question that you asked. All right.
Okay.
But yeah, checklist is ready. I'll just go through the checklist. I think you must have covered everything, but let's see. Yeah. So you you asked all the data gathering right, but like I mentioned, you kind of started queuing up your next question before I answered. That's something that will cut your marks for data gathering also. It's interpersonal skills, but the examiners will get pissed and they'll cut your marks for data gathering also, even if you asked everything. Okay. So it's very good. You've ruled out all the differentials. You've ruled out red flags. You've ruled out fever. That's basically septic arthritis. You rule that out. And rheumatoid morning stiffness and osteoarthritis, if it gets worse with activity, that both are kind of covered in the things that I've already answered. So data gathering is fine. Management wise, so management, you had a lot of things to say. So don't do that. When you know that you have a lot of things to say, you need to pause at the beginning of your management. Just pause and try to understand what the patient wants to hear. So a good way to do that is by summarizing what you're going to say. So how you do that is, so you say so the patient name is Unity, right? So okay, Unity. So I believe that you have a condition called gout, and you asked like, do you know what that is? Once that is done, once the patient replies, now say that. So I'm going to tell you what the disease is, and I'm going to tell you what the treatment, what we can do for you, and what you can do from yourself, like what you can do by yourself, to make the condition better. And I'll also give you some warning signs to look out for. All right. So these are the main things that you have to mention. You can just say that like quickly in just 30 seconds. You can mention that in one sentence, and then say what would you like to hear about, right? So that way the patient will tell you what they want to hear about, right? So one thing is, you can give a treatment, you can give referral, all that is there, but there are things that the patient has to do as well, right? There are lifestyle modifications, all those things need to be covered also. So to do that, if you summarize it, even if you don't get enough time by the end, the examiner knows that okay, he already knows this, that there are things that the patient needs to do, but they didn't have the time to mention it, but you've at least listed that out right in the beginning of your management. So that will help you get the marks. So now looking at the management, see if you notice, the top part you covered, the bottom part you missed. So mentioned what the gout is, explained what it is, and identified the risk factors. That was good. And treatment you mentioned, and follow up you mentioned, and hypertension medication changing you mentioned. But there are things that the patient can do at home. That is basically general advice like rest, elevate the limb, avoiding alcohol. That's alcohol is a very big risk factor, right, for gout. That's something that you have to mention also. And lifestyle changes, basically alcohol, lose weight, exercise. I mentioned I don't do exercise. That's also something that you have to cover. So there are more important things to cover than what is what is the treatment protocol for it, right? It only you'll only find that out when you actually understand what the patient wants to hear, and or what the actual issues are. So in this, gout is not the only issue. The alcohol is an issue, and the not exercising is an issue, and DVLA. So I mentioned that I can't press the brake. It's a very important risk factor, right? I shouldn't be driving right now. So you need to mention that. You make sure you don't drive till your pain subsides. That's very important, right? And safety netting, leaflets and pamphlets. You didn't have time for all that, but that's all right. But make sure that you cover these very important. So even if you give the treatment, he's going to come back with gout if he doesn't manage his lifestyle. All right. And
Okay.
interpersonal skills, this one it took a big hit in this because of that fact that you've interrupted me a lot. That's very important. Don't be very careful when you're doing that. All right.
Okay.
All right. Next case, be very careful. Don't interrupt at all. Just keep be very attentive about that fact. All right.
Okay.
Hi. So
Thank you.
I also know that you have done this case before. Like it was very typical of if you've done the case before. Like you knew what to ask. Like you knew what the patient would come with. So one important thing that I noticed is that you're again spending a lot of time in data gathering. Your data gathering is almost spot on because you're asking like so many questions. But if you notice, you're still asking only close questions. And also you have already so much information in the candidate info itself, right? So if you see, candidate info itself gives you the point that this is a sudden pain and it's on the big toe. By just looking at this case, you can say that this is gout, isn't it? So to prevent asking a lot of questions, you can start asking the patient as soon as you enter. After asking the name and confirming the age, you can say, oh, I can see from my notes that you have come in with pain on your right toe, and this has happened very suddenly. Can you tell me a little bit about it? Right? By just doing that, you have covered a lot of Socrates itself. In that one place, you've covered a lot of Socrates because you've told about the suddenness of the pain, you've told about the site and location of the pain. The rest, the patient itself will give you. So you don't have to ask any other question. So now what you're looking is for the risk factors. Now you have to mainly ask is the P after questions. So you spent a lot of time in Socrates unnecessarily and rule out all the associated symptoms. But you should have mainly over here you're looking for risk factors for why he has gout. So alcohol came out, benroflumethiazide came out, smoking also came out, and also you had an extra point that he was a taxi driver who couldn't press the brake, which is a very important risk factor. As soon as you understand this patient is a risk to the society, you have to address that case. Because if he can't press the brake, that is a natural inclination that he will definitely get into a what we'll say accident, and this will be on the NHS. Because if this patient gets into the accident, the first thing would be like, why didn't you press the brake? Like, I have pain on my leg, I have a condition called gout. Then the doctor's notes will be looked into. Like, why didn't you inform the DVLA? Like, I didn't know I had to inform the DVLA. So then the doctor who looked at him, who did his gout diagnosis, will be implicated. Understand? So as soon as you realize that this patient is at risk for the society, you have to address that immediately. All right? All right.
Yes.
Well, good luck for the next case.
Thank you.
Just one more. So in data gathering, one thing I noticed was again you didn't do an open question this time either. So you started, your first question you asked was where is the pain and how long has it been. So never ask two things at once. That's also important. So always ask only one thing because the patient doesn't know which one that they need to answer. All right. So this is just a general thing. Make sure you don't ask two things at the same time. Always ask one at a time, or just ask an open-ended question, right? That's very important. Okay. But don't worry. this entire thing, it's not about knowledge. All right, be very keep that in mind. It's they're not testing your knowledge. They're not looking to see how much you know. They're only looking to see how well you talk to the patient. All right, and how safe you are. So these are things you need to keep in mind.
Please like and subscribe to Turing Med School. Good luck with your preparation.